Do you know exactly how these little guys work? So these are SSRIs, selective serotonin reuptake inhibitors, commonly known as antidepressants. These are citalopram. You may have heard of sertraline or fluoxetine. There are many different types. Now, last year in the UK, 8.9 million people were prescribed antidepressants. And did you know that women are actually 2.1 times more likely to be on them than men? But do we know exactly what they do in our brain? So when we go to the doctor, we may get prescribed them for anxiety, depression, low mood, stress, overwhelm, sometimes physical related conditions to stress and anxiety, such as IBS, migraines, anything like that. Now, doctors are overrun. They don't have time to go into the detail of how these work, but I think it's important that we all do. So there's a common myth that these actually give us serotonin. Now, that's simply not the case. So what happens when we produce serotonin, which is a neurotransmitter in our brain, is that it helps us to cope and manage better when we've got a more consistent flow of it. It helps us to mentally manage better. It helps us to feel good. It's so much more than just a happy hormone. It does so much for us, both mentally and physically. Now, when we produce a nice consistent flow of serotonin, that's great. But for some reason, as humans, all of our brains absorb that serotonin pretty quickly, which means we have to stay on top of producing that serotonin consistently. Now, if you imagine that serotonin as a particle, a little bit like you may have done in GCSE chemistry, when we produce it, great, it gets absorbed. Now, these guys just help us to recycle a little bit more. So it means that actually our brain synapses hold on to a little bit more of the serotonin to give us a little bit of an extra push. So imagine that we went out for a walk, we got some serotonin. If we were on antidepressants, instead of our brains absorbing that serotonin and going on to the next thing, taking it from the next thing, then these guys would help us to recycle a little bit more. So it's a little bit like stabilizers on a bike, in that you actually have to ride the bike yourself for these to help you along, for the stabilizers on the bike to help you alongside. When you're learning to ride that bike, the stabilizers just give you that little bit of extra support, that little bit of an extra push. The same as SSRIs and antidepressants. When we're on them, we still have to do the work. We still actually have to produce the serotonin ourselves. And these guys just give us that extra bit of support, helps our brain to recycle a little bit more of them. Now, with those stabilizers on the bike, I'm guessing that you may want to take them off eventually once you learn how to ride that bike yourself. And it's the same with these. Eventually, once we learn how to do those things ourselves, we learn how to get ourselves in a good place, we make changes, then eventually we may want to take these away, these stabilizers, these supports. Now, therapy is a really great tool that works alongside SSRIs, antidepressants, to support. Some people think I can't come to therapy because I'm on antidepressants. They actually work really well alongside each other, because the talking therapy just helps to give you those tools to help you to produce the serotonin alongside, so that these guys can do their job as best as possible.